Hi, my name's James Bordoni. I'm one of the CT1s here at Aintree Hospital. And following an audit which I've been involved in, I prepared a short video on central neuraxial blockade and anticoagulants. So this is the paper from which I've taken the guidelines, and it's regional anaesthesia in patients with abnormalities of coagulation. And it provides a concise collaborative guidance, which was from the Association of Anaesthetists of Great Britain and Northern Ireland, from the Obstetric Anaesthetists Association, and also from Regional Anaesthesia UK. So firstly, we're going to look at antiplatelets, and the 5 that we're going to discuss are just on the screen there. So looking at aspirin and dipyridamole, these are generally considered safe and no additional precautions are advised when performing central neuraxial blockade on patients taking these drugs. They're also the only drugs that can be continued safely when an epidural is in situ. Next, for clopidogrel and prasugrel, these need to be stopped 7 days before a block is performed, and that's handily the life cycle of the platelet, so that's quite nice to remember. For ticagrelor, however, it only needs to be stopped 5 days before. All of these can be restarted 6 hours after the block's performed or the epidural catheter is removed, and none of them are recommended to continue when an epidural is in place. Next, looking at the factor Xa inhibitors, that's apixaban and rivaroxaban, and they both contain an X in their name, so that's a nice reminder of their mechanism of action. These need to be stopped in general 48 hours before central neuraxial blockade. However, if a patient's only on a prophylactic dose of rivaroxaban rather than a treatment dose, that can just be 18 hours. They can be restarted 6 hours after a block's been performed or a catheter's been removed, and they can be monitored using anti-10A levels. It's not recommended that these are continued when an epidural catheter is in situ. Now looking at direct thrombin inhibitors, and there's only one of these which is commonly used, and that's dabigatran. And handily, the name is also a clue to the mechanism of action. This needs to be stopped 48 hours prior to central neuraxial blockade, and that's for treatment dose and prophylactic dose, and it can be restarted 6 hours after the block's been performed or the epidural catheter's been removed. It's important to remember with this drug that it's renally excreted, and therefore timings need to be adjusted for patients with renal impairment, and that's shown in the guidelines. And it's again not recommended to be continued when an epidural is in situ. Finally, looking at the thrombolytics, you need to be 10 days clear of a dose of a thrombolytic agent when performing a central neuraxial block, so they need to be 10 days before and 10 days after. They can be monitored by checking fibrinogen, and obviously it's not recommended that these are administered when an epidural is in situ. So the key points that hopefully you'll take away from this is that no precautions need to be taken with aspirin or dipyridamole. Antiplatelets generally need to be stopped 7 days prior to performance of a central neuraxial block. However, for ticagrelor, that only needs to be 5 days. For rivaroxaban prophylaxis, 18 hours. However, for everything else, rivaroxaban, treatment dose, apixaban, and dabigatran, 48 hours generally. You do need to remember that you need to adjust dabigatran for renal function. All of these can be recommenced 6 hours from the block performance or the epidural catheter removal, except the thrombolytics, and you need to be 10 days clear of those, as we just discussed, and none of them are safe to continue when an epidural is in situ. So I've created a summary table of all of the drugs that we've gone over just for reference, and that I've included that as an attachment in the email. There's also a link there to a SurveyMonkey questionnaire, so please follow it and complete it. I promise it's not as lengthy as the previous one, and hopefully it'll be a bit easier this time as well. And finally, thank you all very much for listening, and I hope that this has been helpful.